Hi, my name is Alison Bourgon, and I'm the Manager of Knowledge Translation Strategy at CIHR. Thank you very much for inviting us to be here today. I think my presentation is a little long, so I'm going to go through it fairly high level, and then I would welcome any questions afterwards or at lunch or any time during the day. So just very quickly, for those of you who may not be familiar with CIHR, we are the Government of Canada's funder of health research. We have 13 virtual institutes that support research across the full range of pillars in their different areas of focus. And we also have our head office here in CIHR, and we support investigator-initiated research, so really research where the researchers are coming up with the ideas, priority-driven research, which is research focused on priorities that CIHR has identified, and we also do activities related to sort of more on the the science policy, science side. So that's where I fit in with the knowledge translation, as well as we have ethics and other things that fall within that realm. So just to provide a quick history of where KT is at CIHR, for those of you who are not aware, it is actually included in our mandate. So our mandate is not only for the creation, but it's actually embedded there as being in, that for actually the translation of the knowledge that's created as well. So CIHR was funded created in 2000, and since that time, really how KT is administered at CIHR has changed. So we started with a standalone KT strategy, and now we've moved to a place where KT is very much embedded throughout everything that we're doing, as is evidenced by our newest strategy, Health Research Roadmap 2. So it is now a cross-cutting theme across what we're doing. Similarly, at the same time, we've also seen sort of a shift in how we've funded KT through our programs. So back when we were trying to establish and build some more capacity in this area, we did have standalone programs to support KT and commercialization. And now we've had a bit of a transition where it's felt that, this is very much a part of what's happening in the research community, and it's being embedded into our existing programs. So we are definitely seeing a shift as sort of how it's being incorporated at CIHR and within the research community is happening. This is CIHR's definition of KT, but I'm actually not going to speak to it. I'm just going to actually move on to what does this definition actually mean. So for us, knowledge translation is really just about making sure that the findings, is about engaging and sharing the research findings with those who can use them. And we have a definition for knowledge user, which basically means anybody who can use your findings. So this could be a policy, a decision maker, a patient, a caregiver, a practitioner. It can also mean other researchers if they're the most appropriate person for the target of your research. Similarly, as was already mentioned, it's about selecting approaches or activities that really depend on the research that's being conducted, what you anticipate the findings may be, and what you would hope that your outcomes could be as well. And just to note that our definition does include commercialization as a specific type of knowledge translation. And I just included this picture from the K-STAR paper because I think it does a wonderful job of showing all the different terms that are out there for KT. So just to highlight that CIHR does use the term knowledge translation, but we don't mind if CIHR-funded researchers use any of these terms, including knowledge mobilization, really as long as you're thinking about who might be interested in my findings and how can I help move them into policy or practice to have an impact. So why does KT matter to CIHR? So as you are aware, probably as we all are, as government funders, we are increasingly in a position where we are, trying to show the benefit of the publicly funded research that we support. So in turn, we're looking to researchers to help us demonstrate what the benefit is of the research that we're funding. And really, knowledge translation is the mechanism by which what we fund can have an impact. So how can we make an impact? So in KT, we view it as very much a two-way interaction between the individuals who are creating the knowledge and the people who are using it. And so through this two-way exchange or partnership, it's about researchers learning about what are the needs of society, but also having society be able to engage in the process and inform their research. So we really view it as an essential for actually transforming any changes into the healthcare system. And by engaging with the users, it helps to ensure that the research that's created is relevant and hopefully will be more likely to actually be used. So sometimes you hear the question about when is KT relevant? And from my perspective, I would say always. It's just that the way in which it's done, it just depends on the type of research that you're doing. So as was already mentioned, that the approach and activities should be tailored based on the research, your findings, your outcomes. So for many researchers, particularly in the biomedical setting, really thinking about how we can share the findings at the end of the grant may be sufficient and the most appropriate. But even if you are doing that, it's always valuable to think about, who are you trying to target through your publications, your presentations, making sure that you're selecting, the most appropriate vehicles. And then still keeping in mind, is there knowledge users who could be interested and potentially be engaged in your research? Regardless of the type of research that you're doing, we do encourage and hope that KT is always a conscious decision. It's something that's thought of at the start, and so that it's not something that you get to the end of your grant and think, oh, what am I going to do now? So recognizing the scope and the intensity very much can vary, but we do just ask people to please think about it at the front so that you're actually doing what you're hoping to do throughout the course of your research. So as I alluded to already, CIHR views KT in sort of two broad categories. The first is end-of-grant KT, and this involves the sharing or applying of research as either you've gotten to a point where your research is significantly progressed or when it's actually completed. It involves planning for how the findings can be made available or tailored for your audience. And it can range from, we see the standard dissemination, such as publications, presentations. We also see patents. Or it can be a more intense process, such as workshops for a specific audience or the development of tools, services, products, or even implementation. The other approach that we support is the integrated KT, or I might call it IKT if I slip into acronyms. And this is where the researchers and knowledge users are working together throughout the process, and that involves where you have your knowledge users engaged in creating the research question. And by this meaningful engagement, as mentioned, we hope that the results will be more relevant and therefore used. So some tips for end-of-grant KT, just to ensure that there's that match between your findings, the targeted audience, and the activities that you're selecting. To identify who your target audience is up front. So who else besides any knowledge users that are listed on your grant might be interested in the findings of your research. Also suggest tailoring of your KT activities or messages to the needs of your audience. So think about the evidence of what formats might be most effective for the group that you're trying to target. And explain how you selected your strategy. So is it evidence-based? Have there been other groups who've used this approach to get a message to a similar or engage a similar audience? And does your team have the individuals on it to actually enable you to do this strategy, or do you need to identify new people? And so we also ask that, as mentioned, ensure that the activities are thought of ahead of time so that they're appropriately budgeted for. And then it's an iterative process, so you're revising it, obviously, as the research unfolds. So I think one of the most important tips I would say for our IKT is just the recognition that it's not our two approaches are not exclusive. So I would say all research should have an end-of-grant KT. So if you're doing integrated KT and knowledge users, you still want to think about at the end of the grant, how can you share your research findings? And this involves distinguishing between the knowledge users, as mentioned, that are on your project with those that you're trying to target at the end. And within your application, it is important, or just in your research, to demonstrate that the question that you're trying to ingest has been validated as being important to the knowledge users, that you have the right knowledge users who are actually in a position to be able to make decisions or to influence practice. And we do hear this a lot about organizations who said, I've been asked to do something, but, a CEO might have heard of, maybe there was like 50 people that signed letters of support, but he's only aware of 2. So you want to make sure that it's at the right level where there's somebody who can actually make a decision if the research goes forward. And then just describing how they'll be involved in the project, but also using the findings. So very quickly, just wanted to highlight the different ways that CIHR is supporting knowledge translation. So we have through our funding mechanisms. So this is support for the use of KT approaches. So this can include integrated KT, patient engagement, community-based research, depending on the terms being used by your field or the funding opportunity. We also support the practice of KT, so this would be your end of grant, KT, your dissemination, and then also the discipline of KT, so the study of KT, your KT science, your implementation science. And just a recognition that from CIHR's perspective, we're also engaged in doing KT. So we do activities to bring evidence from connect researchers and policymakers, so we organize events called Best Brains Exchanges, and we have other vehicles as well. We do profile findings for individual projects. So, for example, on the CIHR website, we have a section called Health Research in Action. So keep this in mind if you have something exciting. We're always happy to highlight either great research or great KT. And lastly, we also have policies and platforms to help enable moving research into practice. So with the Tri-Councils, we have our policy on open access. CIHR does support PubMed Central Canada as a national platform to help researchers comply. So CIHR is also involved, so we're very much viewed as a partner within this space. So as I mentioned, CIHR has funding through basically two different strategies. The first is the investigator-initiated research, and we have launched a new suite of programs, so I'll speak to that in just a minute. And we also have our priority-driven research. So this is, we have quite a number of major initiatives that support research in targeted areas that are a priority to CIHR. So these include patient-oriented research, preventive action, Aboriginal people's health, and chronic conditions are the large buckets that are our current refresh priorities. But within all of our signature initiatives, there's a very heavy KT focus in most of them. This can include things such as the integrated KT, commercialization, just depending on the focus of our initiatives. So if you are engaged in those, you'll probably be seeing some KT in that space. So I'm not going to speak to all the bullets on this slide, but I just wanted to highlight that CIHR does have, if you are applying for our, so what we called open programs, we used to have a program called the Open Operating Grant Program, which was CIHR's largest program. And we also had, as I mentioned before, our standalone KT and commercialization programs. These programs are no longer, they have sunsetted. So now in January, there's a registration. In March, there's the full application deadline for the first launch of our project scheme. So within our investigator-initiated research space, we have two complementary funding schemes. The first is the project scheme to, as the name implies, support projects. The second is the foundation, which is supporting programs of research. Both of these are for the full spectrum of health topics, but the difference is that they're including research, but also knowledge translation. So the activities that we previously funded through our standalone programs are now being encompassed within one overall program. And this will, I thought really what I'd focus today is more on something that you may have seen but potentially not understood. We're calling it a special consideration. So within the project scheme, the idea is that we believe we're at a place where KT is going to continue to be funded in this space, but we also recognize it takes more time to engage partners and knowledge users. So we want to have an incentive for this to continue and just to make sure that we're continuing to really fund the same level of investment that we had through our previous programs. So we have what's called a special consideration for knowledge translation or commercialization research that involves a knowledge user and or a partner. And this will include something that you self-identify for. So the process is the same, the peer review is the same, but it is something where basically we're trying to encourage this to continue to happen. And if people have questions about it, it's a little bit, probably takes longer to explain than I have now. So just come see me and I'd be happy to provide you with a little bit more information. But even if you do not select the special consideration, we're still promoting the inclusion of partners or knowledge users in the process, as well as in our peer review processes. I think at the time I'm not really going to speak to these slides. I'll just skim through them. But just to know that there is KT and commercialization aspects included in the review criteria for the special consideration, as well as the foundation scheme. So I think I'm running a little long, so I won't speak to it. But if you have any questions about that, I'd be happy to help you identify how you could incorporate KT within those sections. I just thought it would be helpful maybe to highlight a few examples of how CIHR has in the past funded research that I think would be relevant to this group. So I've just pulled out a few different examples of research that's funded mental health research in the areas of, for example, treating post-traumatic stress, mental health for youth or populations that are at high risk or disadvantaged, as well as addressing access to care. So there is a lot of research that we funded in the area that's relevant to the CPA. Similarly, we have many major initiatives, which some of them were listed on my first slide. I thought today I'd just do a quick snapshot of one of them that I thought might be relevant to this group. So it is the Ehealth Innovations for Partnership program. And this is an example where there's requirements for not only researchers, but also the inclusion of health system and users and health technology partners to be brought together to co-design e-health solutions. CIHR has helped to organize 10 regional workshops to bring together the health innovation communities and the health technology partners that are interested in the similar solutions. And there is definitely a strong integrated KT component. There's also some commercialization angles within there, so a lot of great KT happening within this initiative. I also thought I'd just pull a few examples from some of our initiatives or our more priority-driven funding that I think, again, relate to this group. So some examples of mental health research being done in the areas of primary care, Indigenous peoples, youth, and just the different approaches being used involve technologies, partnerships, and networks. And my the last thing I thought I'd highlight today is just one of those, as I think a rather large example of what CIHR has funded in an area that's relevant. So this is the Transformational Research in Adolescent Mental Health. We call it TRAM. It's a little easier to remember. So this is it's a 5-year grant. It's a $25 million partnership between CIHR and the Graham Beck Foundation. And it's about bringing transformational change in youth and adolescent mental health. And it was the first initiative launched through CIHR's strategy for patient-oriented research. So the selection of this was done through a peer review panel that consisted of researchers, but also patients, family, youth representatives, policymakers, and service delivery experts. So CIHR's, not also looking at using an IKT approach in terms of involving, in our processes, very much knowledge users and partners. And the recipient is Dr., I'm sorry if I get this wrong, it's Ashkak Mala, and he was selected as the recipient for this grant. And so the goal of Access is to use research evidence to bring about positive change within 5 years to the way that Canada cares for young people with mental illness. And the network's hoping to achieve this by connecting patients and youth with researchers, healthcare professionals, and decision makers. It will also bridge the gap between research evidence and healthcare practice and policy, and allow patients and families to benefit from research evidence by bringing the most promising interventions to the front lines of healthcare. So just in closing, I just wanted to highlight that CIHR does have quite a long list of resources. This includes, we do have a guide for doing KT at CIHR. It includes some of the similar levels of detail that was in the previous presentation, so it's great to see some of the similarities in terms of questions you might want to think about, some different approaches you may want to consider, as well as some examples to help you work through both end-of-grant KT as well as integrated KT. And then we also have different resources. If you're involving patients, there's also some resources in terms of patient-oriented framework and different tips in that space as well. And just to mention, I do have hard copies of the guide. I just didn't bring them today, but if anyone wants one, I'm happy to get some at lunch, so just let me know, and I can easily zip over to CIHR. So thank you very much.